Great Nigerians and wonderful viewers of Living Television and Living Radio 90.9. Welcome again today in your favorite program, Nigeria Today. In Nigeria Today, as usual, we will be treating this a particular sickness or disease that has ravaged this country, Nigeria. We're very fortunate down here at this part of the globe. We are not yet experiencing it here in Abia State particularly, but we know it's almost here, it's in Imo State and some other sister states around here. And that is why it is important to look at it. What is cholera? From the layman's point of view, we say cholera is a bacterial disease causing severe diarrhea and dehydration, usually spread in water. Well, we see that as the layman's definition, and also the lexical definition that is quite different from the professional definition. Today in the studio I have a medical doctor, a professional and also a consultant, Dr. Imodi, who is going to do justice to this bacteria. We're going to look at the real medical definition of bacteria, the real definition of bacteria, the causes of bacteria, can it be prevented, and also the cure. And in the studio with me, like I said earlier, is Dr. Ugo Imodi. Dr. Ugo Imodi is a consultant with the teaching hospital and so many other hospitals in Abia State here. Dr. Imodi, you're welcome to the program.
Thank you very much.
All right, Dr. Imodi, let us start with this thing called cholera. What is it?
Well, thank you very much for fortunately and unfortunately enough, this particular ailment has been one of the leading cases, not only in the nation but Africa as a whole. Now, cholera is an acute bacterial infection. Acute in the sense that it is short term, you understand? And the acute bacterial infection that is actually contaminated by injection that's taken in of contaminated food and water caused by the bacterium called cholera vibrio or vibrio cholera.
Okay, if that is what cholera is, and then at what point you said from water and food.
Yeah.
All right, how can one get involved? What kind of water? Because these days, considering the nature of the economy, I think the poor man's biggest water is pure water. I think the kind of waters are the ones at the borehole. Are they the kind of waters we're supposed to avoid?
Water in general. Most of these boreholes are not really well treated, and most of them are also, contaminated. So when I mean contaminated water, I mean dirty water per se. Water that didn't actually pass through the normal filtering processes. Water that wasn't really treated in the normal standard procedures. Water that probably has been infected with so many organisms, microorganisms, deaths. Not necessarily borehole water, but any water, provided it is contaminated. So once it is contaminated and the person ingest takes it, you see, most of this contaminated water contains that bacterium called vibrio cholera, which is the bacterium that's actually that causes that cholera, and the acute infection starts up immediately.
Okay, and now talking about contaminated water or food, how can one's food be part of the cause of this cholera?
Okay, very well said. When this water is not really treated very well, or per se wasn't really boiled very well, and this water is also used in cooking food. Even the food itself probably is also contaminated with this vibrio cholera that causes the bacteria, the infection. The bacteria on us, the infection starts growing, and we also need to know that it is a fatal case in the sense that when one gets or gets contaminated with this disease, cholera, if not well treated, immediately in acute stage, it could lead to severe and debilitating effects. In fact, in most cases, we've noticed a situation whereby, in a long-term range, infection could lead to shock or seizures in the brain. Yes.
Okay, at what point do we say cholera is fatal?
Yes, well, the disease can be managed in the acute form stage, in the onset. I mean, within a short period of time, when one or a patient gets that disease, cholera, and is well managed, it could go, it could relapse. But when the problem becomes a very big problem when it stays for a very long time, because there will be some other collateral damages in the organ system. So once that happens, which could, when I mean chronic, I mean a long time, and if you're managing it and you don't manage it properly, the disease could now lead to an extreme case of, infertility. When I mean infertility, not regarding to that infertility as well, it could be very much fatal. It could affect the brain cells, it could affect the CSF, the cerebrospinal fluid of the brain. It could also affect the lobes, in fact the brain itself, the meninges, the brain covers, causing inflammation. It could even lead to meningitis, and of course, other associated secondary symptoms could happen, such as seizures, such as shock, and so many things.
All right, the World Health Organization in one of their journals, and also by this NCDC, talked about 500 lives that are lost as a result of this cholera. So at what point does it kill?
Come again.
Cholera.
Yes.
I said there've been journals talking about Nigeria losing about 500 persons yearly as a result of this disease called cholera. At what point does cholera kill?
Okay. Now, we know that cholera in its long range could cause diarrhea. It could also cause dehydration. Now, let's take the one after the other. If the person didn't immediately treat that diarrhea, of course, we know that the person will be losing fluids. And when the fluids are going, of course, the venous return, the volume of the blood becomes very low. And when the volume of blood becomes very low, the venous return to the heart also becomes low. That's why we talk about shock. Because one thing with cholera infection is that once it happens, you're having diarrhea, you're being dehydrated, there's loss of fluid, not just only water. And when all those things happen, a total transcellular fluids or circulating fluids coming back to the heart, which is the venous return, becomes very low. And when it becomes low, the heart can also not pump enough, because there's this law that they call a Franz-Sterling's law. The heart pumps the quantity of blood that also enters into it through venous return. So if low quantity of fluid and blood enters the heart, low quantity is also pumped. So over time, there will be a circulatory shock. And when there's circulatory shock, the person might actually die of asphyxia, lack of oxygen. The person could also faint, because if it affects the brain, seizures and other complications will also happen. So it's the cholera disease itself causes a major issue, or is fatal when it has reached the stage of causing very low blood volume, low fluid, and of course shock, circulatory shock.
Okay, before we go to the symptoms of this deadly disease called cholera, you talked about bacterium vibrio cholera, and then as a result of food and water contamination.
Yes.
As a result of food and water contamination, how can this bacterium vibrio cholera be stopped?
Okay, let's take the one after the other. One, personal hygiene is very important.
Okay.
When a person is very neat, the environment is very clean, of course, we all know that there is less likelihood of the water or the food being contaminated. Now, secondly, we also have to take enough fluids every time. But the key point is personal hygiene, because the disease itself most times spreads through contaminated food and water. So if it's food, we ensure that the food is personally kept clean, hygienic, well boiled, and kept, at a controlled temperature so that it doesn't get contaminated. If it is water, we ensure that we take very neat and clean water, possibly distilled water. We also ensure that we take filtered water and also know the source where the water is also coming from.
Okay, now talking about this, let us look at this. What are the symptoms? How will one know, or rather observe that yes, his cholera has come in? How do we know? What are the symptoms?
Okay, there are key symptoms one should always watch out once there is cholera infection. One of such is diarrhea. We'll be talking about diarrhea. One of such is diarrhea. Another one is dehydration, loss of fluid. The person starts thinning, shrinking, the blood volume starts reducing. So we have diarrhea, we have dehydration, you could also have dysentery. Sometimes things like polio would enter. You have kind of typhoid infections. Most patients now present with typhoid infections and they don't know where the source is coming from. You go to all these pretend medicine stores, they're always buying ciprofloxacin, ceftriaxone injections, all forms of aquaclave, blah, blah, blah. So the key symptoms are diarrhea, dehydration. We talk things like dysentery, poliomyelitis, things like typhoid infections, and so on and so forth.
So at what point do you want to experience a shock and seizure?
Okay, it's a shock. Let's know what is shock. They will not know how the cholera causes that shock.
Okay.
Shock is not just battery shock.
Okay.
In medical terms, shock would mean it's circulatory shock, plus circulatory shock. Shock is when there is low tissue perfusion, low oxygen tension in the blood that could enter the tissues or organ systems. You see, when there is dehydration and there is low blood fluid, low blood volume, the extracellular fluid volume is very low. You see, low quantity of this blood returns to the heart. Like I told you earlier, the quantity of blood that enters the heart is the one the blood pumps out. That is what we call Frank Stanley's law. Now, if you have cholera and the fluid volume is low, then that low volume also enters the heart, and the heart has the ability to pump what it takes. Now, the brain cells are very stingy. I won't say greedy, stingy, in the sense that whatever you take into the body, 75% goes to the brain. That's why you see fainting. It doesn't want to know if normally it gets 100% of fluid. The brain takes 75. The 25% are now distributed to the upper limbs, the lower limbs, and the whole body tissues. Now, assuming low blood volume due to low quantity of fluid, due to diarrhea, which of course is due to cholera, enters into the body system. And let's say instead of 100%, there is 30%. The blood will still take 75% of that 30%. So have you seen that if you take 75% of that 30%, that is not entering due to dehydration, the very low quantity of fluid is not into the body system. And of course, the level of oxygen perfusion, oxygen penetration to the tissue becomes very low. We're entering shock level. Shock is just simply low oxygen perfusion or penetration to the tissues. And the person will not feel fainting because low quantity of oxygen is also entering the brain.
Now, before you talk about that seizure, because like shock and seizure, they are hand in glove. They work hand in glove. All right. Before we talk about that seizure now, when you talk about fluid and dehydration, most of the moment you talk about dehydration, people think about drinking water. You're talking about fluid here. And there are other things that are included.
When you take in water, there are so many fluids in the body. Medically, to the layman, dehydration is just water.
Yes.
But in this time, when you take in water or fluid, we have so many fluids in the body. You have the extracellular fluid, the fluid or the water outside the cells. You have the intracellular fluids, the one inside the cells, that the cells, the body cells use in their metabolism. in their digestion process and the rest. They have transcellular fluids, fluids that are minute but very essential, fluids like the lymph, that works alongside with the blood. You have also the CSF, the cerebrospinal fluid in the brain. These are transcellular fluids. So when I mean fluid, I mean a total body volume, the total body water in the body, not just ordinary water.
Okay, it is also important to draw a little line here and also explain better, because when you talk about fluid, and then I'd say it's not just all about water. A lot of people might go for what they call there are so many drinks, minerals, Coke, Fanta, Pepsi, and so on, that is not very healthy for every person, especially the diabetic ones and so on. And then also they have the other ones, 5 Alive or 5 10 or 5 and so on, all these things. Are they part of this fluid, or is it essentially water?
You mean in terms of taking fluid?
Yes.
Water is the key.
Okay.
Water is the essential, or let me say the universal solvent, from which these other fluids are made up of. Yes, we can take other fluids like what you said, the juice and whatever, depending on your health status. But essentially, what I'm talking about here is water, H2O.
Okay. So water is enough for that. And then let us also look at this. We talked about shock and seizure. You've explained shock and then seizure.
Okay. Well, to the layman, seizures are epilepsy.
One is epileptic.
Yes. Then medically, seizures are abnormal neuronal discharge from the brain. It's naturally the brain cells, which are called the neurons or the nerve cells, they spark, they transmit impulses, electrical signals at a certain rate of velocity, speed. Now, when for some reasons, due to this, it's cholera or whatever, or some chronic infections, fatal accidents, trauma, and the rest of them, what we call post-traumatic stress disorders, these neurons transmit at much higher rates. In fact, their transmission becomes rocket-like, very fast. So seizure, in this sense, means an abnormal discharge from the brain cells, from the neurons, from the nerve cells. So when these cells start discharging, transmitting their impulses at abnormal rate of velocity, that is what is called seizure.
All right, our wonderful listeners and viewers of Living Television, our phone lines are open. You can always call us now on 070-3367-900. I take it again, 070-3367-900. You can call us on that if you have a question, a contribution, if you're in the medical field and there is something, or you have a question, the medical doctor is there so that you can also ask your questions and the questions will be attended to. It is important because we've heard about cholera and it's almost everywhere. It's ravaging so many places. This morning news about 63 dead and about 500 and something, suspected cases of cholera. Where we've not had any about, I just said, but that is not for us to relax. So it is important. If you have a question, you can ask now. 070-33-673-900. You can call us. Okay, Doc. Now about the symptoms. We're talking about the system. Well, let us come to treatment. These days there was something you mentioned here. Most often, when there is any symptom, whether it is that of cholera or whatever it is, just like typhoid and malaria, people will quickly run to the patent medicine store without going for a checkup and so on. Most often because of the nature of the economy and one's finance and so on. So what are the treatment? Are there easy way of handling this?
Yes, of course there are. One of such ways people, even the layman knows is ORH. Oral rehydration therapy. In the medical field, we call it IV, intravenous therapy. You rehydrate, rehydration. Of course, you treat symptoms the way they come. You know, because you're losing fluids, naturally, it's very important that you also rehydrate yourself. You understand? So, simple techniques involves rehydration. Take enough water. You know, sometimes you also do what we call an IV fluid treatment, intravenous fluid treatment. You can always use normal saline. You go to all these nurses, even if it's not in the hospital, they set up a line for you, intravenous, therapy. They put an IV through your vein and rehydrate you with normal saline. Saline is sodium chloride solution, but if you cannot do that, you can always buy some antibiotics. We have a good number of antibiotics that you can use because cholera is a bacterial infection. So you could buy ciprofloxacillin 500 milligrams. You can buy Apaclave antibiotics 625 milligrams. If you're the one that likes injection, you can use ceftriaxone injection vials, IV. So the key, in general, just rehydrate yourself. Oral rehydration therapy. You can use IV therapy, intravenous therapy. You can use antibiotics, the ones I've just mentioned.
IV therapy includes IV fluids.
IV fluids,
Now talking about ORT, that there is a sachet they sell in most of these chemists that you pour into clean water, and then to rehydrate yourself. Now, are there no effects of these ones that are sold in most of these chemists, or is ordinary water okay?
Well,
because someone will tell that I've seen somebody saying you just take 7-Up with salt, add salt in the 7-Up.
Those ones could be like a first aid, yes. Oral rehydration therapy is just a normal saline solution, ORT, a kind of salt and water.
Okay.
Just get a solution of, you understand? But we still have saline, the ones they sell in the market.
Yeah.
You can set up a line, IV. That's the IV therapy.
All right. Now, when you're talking about these ORT and so on, what about a diabetic patient? When someone is diabetic, there are so many things you are asked to avoid.
Yeah.
Especially as it concerns salt, sugar, and
that is why we have an option. You can rehydrate with ordinary water, you have antibiotics.
Okay.
You don't need to always use the option.
Okay. Now, that is what I also know, as a mass communicator in those days when we were coming across most of these things, there's the one they call the palliative case, At what point do they apply that palliative case? That is the intravenous therapy and oral rehydration.
That, like I said from the beginning, from the initial, that this case could be acute or chronic. Acute is short range. At the onset, one gets this cholera infection. These things can relapse, just minor treatments. But due to carelessness or, like you said, economic situations, and you are allowed to proceed to the chronic stage, then use this palliative measure, which is oral rehydration therapy. That is the key. Because when it stays a long time, it could even be fatal. Because once the brains are involved, seizures, shock, blood circulatory shock can enter. So, in fact, at chronic stage, the disease can be fatal, can even be, lethal. It could even lead to death if care is not taken. Because once there is shock, a lot of organs are shut down because the oxygen penetration, the oxygen perfusion ratio is very, very low. And of course, the person might die of asphyxia, which is low tissue oxygen tension or hypoxic levels.
Okay, before we go, it is important to look at what are the preventive measures.
Preventive measures, be very neat, take clean water, eat very well cooked, prepared food. Sanitary environment is the key. Ensure that your water is well boiled. Take clean water to avoid the ingestion, the taking in of the bacterium, Vibrio cholera, which is the major microorganism, bacteria that causes cholera. So once you take a clean water, you know why? When you boil water, the bacteria cannot survive extremes of temperature. They will die off. If you filter it too, it will not, because that Vibrio cholera belongs to a species of bacteria they call Vibrio. You know, we have different types of bacteria. You have the rods, you have the one that's spiral, you have the spherical, you have the Vibrio. So this particular species does not survive extremes of temperature. So if you boil your water and it's very neat, I mean, of course, there's no way you can get it. Make sure if it's vegetable you're eating or food, wash it properly. Eat well, clean food, you know, and it's avoidable.
Now, talking about the environment, can one inhale this bacteria? Can one inhale it? You know, as you breathe it, is it possible?
Inhalation is very, very infinitesimal, very minor, very small.
Okay.
About 0.00000. So it's just the ingestion, the taking in of, you know, food and water contaminated with this bacteria.
All right, and before we come to the end of the program, we've been talking with a consultant surgeon, Dr. Ugo Imode of the Teaching Hospital in Enyimba here in Aba. And before we go, Doc, what is your general advice to the people? Remember, the thing is ravaging so many states and the local governments in Nigeria today. In as much as we've not had the cases openly here in the state, what is your advice to our people?
Luckily enough, our government is doing beautifully, keeping the environment very neat. I only advise people that if you want to be cholera free, there's no shortcuts, that will be very neat. Eat good food, well-prepared food, most importantly, a balanced diet. Thank you very much.
Please, before you go, which food, the way Nigeria is now, which one is balanced?
Balanced diet, yes. There are many ways you can eat a balanced diet.
Yes.
It mustn't be all the essential nutrients of food like protein, carbohydrate, but I mean, in your house, I know there are trees that grow. You could pluck mango, orange, even there's corn now. This protein essential minerals. When you're taking the out of balanced diet, then you can eat beans.
Okay.
I mean, these are things that you don't need to spend so much.
Beans is very costly.
It's costly.
It's 8,000.
Well, you are eating a bit. You can take 2 cups. I'll be profit.
1,000.
Yeah.
All right, so what you're telling us is that when you talk about balanced diet, it mustn't be fried chicken from any of the fast food. It mustn't be fried rice. It mustn't be this and that.
Well,
and even those natural foods, you know, fruits, you know, at your backyard can also serve as a balanced diet. All right, our wonderful listeners and viewers, there's the much we are going to take today. You've had it all from Dr. Ugo Imode. For you to run away from this, first and foremost, personal hygiene. You must keep your environment clean and be clean yourself. And that is one of the fastest ways of staying away from cholera. Remember, these are the nearby states and so on, sister states here and there. So for us to avoid it, you've heard his advice, and I'm sure you're going to take this. And this is the much we're going to take today. And my guest today has been Dr. Ugo Imode, a consultant with Abia State Teaching Hospital, the University here in Aba. Dr. Ugo, we are pleased to have you here today.
Thank you very much.
And this is your command, Chinedum Godson Adiele. Keep it with us. We'll be coming with interesting programs to make sure you stay healthy and fit. Bye for now.